Dr. Trek Lyons. We're talking about heart health this month, and we want to know some things that will help us keep fit for longer and healthy, of course.
We have mountains of research that show that as people keep their heart consistently active and that you're able to get to a moderate or even a low heart range above resting heart rate, that people are going to be a lot more fit. They're going to be able to avoid a lot of chronic illnesses as well. Some of those diseases are heavily genetically predisposed, but doing everything that we can at least delay some of their onset, or we can prevent it at some times, and people are able to function and be more independent, which to me is a major thing with what your health is.
Exactly. You work a lot with the youth and with Utah State Aggies, and tell me the difference between, I know you see young people, but when someone gets a little older, how are we going to keep them active and fit? Small little exercises, what do you suggest?
I hate that it's so personal right now as I'm starting to leave being younger, but I think for all of us, we have certain sports that we're able to participate in as we're younger, and then with certain injuries or whatever our genetic makeup is, we somewhat get filtered into different sports. For some of us, we may not be able to run into our 70s, and we need to find other activities, other sports, whether it's swimming, whether it's cycling, whether it's doing yoga, tai chi, Pilates, cross training on an exercise bike. There are many things that people can do with the bodies that they have, whether they have arthritis in their knees, if they're diabetic, if they have heart disease. There are many things that they can do and that they still ought to do to keep themselves as independent as long as they can.
Mm-hmm. And you see a lot of people with sport injuries and whatnot, and does that affect someone's heart health because it might slow them down a little bit?
Well, I think that the part that it slows them down is that when they're recovering from an injury in their extremities, if it's in their foot, their ankle, or their knees, or hip, or back, it may convince them that they shouldn't stay as active or that they can't do exercises. Some of us are tied to certain exercises maybe more than we ought to be, and that we need to learn there are other ways to cross-train and accept other things. I didn't typically do yoga many years ago, but now I find that that's a great activity, and that as I get
it's
older,
easier.
It is. It's easier. I look kind of silly at first.
And you feel silly.
Yeah, but as I start doing it more, I start to realize that my ability to hold different poses, to do different things, improves, and I think that's important with any kind of sport that you decided to pick up something different, because it still boils down, my heart has got to get that fitness and conditioning training, because it's not going to get conditioned if I just think about it.
I totally agree. Well, thank you. Now that we're talking about physical, working out, and you specialize in that. Tell me a little bit about what you do here at Intermountain and the Logan Regional Hospital.
I'm a physical therapist in our sports medicine clinic, and so a lot of times what we're working at is people that have been injured, whether they've had surgery or whatnot, and then we're trying to get them back to what activities or what level of function they were doing before they injured themselves or had surgery.
So do you find a lot of times these people don't want to do any sort of exercise at all?
Yeah, sometimes you do, and sometimes they're afraid because it hurts, or they've been injured, or last time they did anything is when they hurt themselves. And so a lot of it, we're trying to convince them of the things they need to do, and the importance. If you don't have certain motion in your shoulder or your ankle or strength, you can't do normal functional things, even walking. And then as they gain that momentum back, then they can get back into activities, and so they can get back and enjoy life, where if you don't have the strength or function, simple things of doing your hair or tying your shoes or going up and down stairs, you struggle doing.
Exactly. So tell me some different levels of exercise for maybe someone younger, someone older that you would suggest.
I think, first of all, it depends on what activities you've been doing, and then slowly progressing, starting off, a bike or walking if you haven't done very much, and then getting back up to any cardio, running. We have sports training programs, and so it's kind of the wide variety. But a lot of what we see are injuries is they start off too much too soon, and so
we all think we're invincible.
That's true, and I've been there myself. But if you start slow and then slowly progress back up to the activities, then you can get in and enjoy them. And so, if you haven't run and you want to train to do a 5 or 10K, start off running a mile and then progress from there, not more than 10% a week.
And young people that are maybe injured, what do you suggest for them?
You know, there's lots of studies with preventing injuries. You know, first, if you're injured, make sure you see a doctor and get diagnosed correctly. You know, a lot of times people with technology out there try to diagnose themselves, and they'll miss it, or, you know, read something on the internet that might not be the latest research or the correct things, and get diagnosed, and then you can treat that and get their strength back and their function. And, you know, some things, you know, might need surgery if you have something torn in the knee or the shoulder and need that to be able to get back to your activities.
Well, definitely some good points about heart health and keeping physically fit. Those are all important things that I appreciate you guys here at the Budge Clinic, regional hospital here, Logan Regional, Intermountain guys. Thank you guys so much. I appreciate you.
Thank you.